Hello, and welcome to Nonprofit Spotlight. This is our very first show and segment. I am your host, Michelle Overton. I have a special show for you today. My guest is the founder and CEO of Evergreen Nursing Health, LLC. She works towards revolutionizing in-home healthcare with innovative and AI-powered solutions. She has a bachelor's degree in registered nursing from Chamberlain University, as well as an extensive clinical experience in various medical fields, including cardiac, ICU, and home health. All of this is to provide compassionate and targeted care for patients. She has an interesting background, having studied in both the US and Germany, so she is multilingual and able to converse in English and German. So this gives her a wide range of communication skills with her diverse clients and medical teams. She is passionate about continuous professional development and interdisciplinary collaboration and works seamlessly with medical professionals to achieve the best possible patient outcomes. Her skills in technological innovation and entrepreneurship help her to create and implement cutting-edge solutions for home care. So please welcome founder and CEO of Evergreen Nursing Health, Deanna Nelsen. Deanna, welcome.
What an introduction. Thank you, Michelle. That was very nice.
Thank you for coming today.
Thank you.
So let's just get started, and just please tell us a little bit about yourself and how you got started in nursing.
So I got quite an interesting history. I started out in nursing in Germany, and I went to a nursing school in Nuremberg, Germany. So prior to that, I worked in a nursing home, private nursing home in kind of a small village in Bavaria. So I did 1 year in a nursing facility, and then I applied for nursing school and got admitted in Nuremberg from 1990 to 1993. So little did I know that I would end up in the United States, because I was never planning to be in the United States or living in the United States. But my husband was a soldier at the time, stationed in Nuremberg, and that's how we met, and we ended up in the United States. So in 1993, 1994, we moved to the United States, and anyway, I just passed my nursing board in Germany. I was so excited, and I thought, oh my goodness, so everything's gonna go well. Little did I know that when I came to the United States, people said, you're not a nurse. I say, what? I'm not a nurse? Have you passed the NCLEX? And I was like, what's that? I didn't even know what the NCLEX was, the Board of Nursing. My English skills were very little. I had to learn English because I had never English in school. Took me 7 years.
Wow, that's great.
So between those 7 years, I worked in a variety of settings. I worked as a caregiver on a medical floor. I worked in orthopedics as a technician. I worked as a secretary to improve my English skills. And then I worked in phlebotomy to learn how to draw blood. And then I worked in ICU as a technician, and then finally passed my nursing board and became an RN. That was exciting.
That's quite a journey.
Yeah, it was a long journey, yes. But resilience, you have to, if you put a goal to something, follow up with that goal, and work hard, And sometimes humiliation is being humiliated, starting from the beginning is actually sometimes not a bad thing, because it makes you stronger, and all the experiences you gain over the years. Right? You become somebody. So
that is so inspiring. So what services do you offer?
So let me, before I answer the question, let me explain. I used to work in ICU, and for some reason I got the urge, I want to go into home health. I never had home health, but I feel like that's something I need to do. So I had a patient, and the mom was a nurse working in home health. And I asked her, I always had the feeling I want to work in home health. And she said, oh yes, there is an opening. One nurse just left, and you could apply. So that's what I did. I applied for the job, and I got it, and I started home health unprepared new specialty. So I worked in home for a couple of years, and then I got the same urgency. Well, was like, I like to have my own home care business. And I came up with the name Evergreen because, I like green, it's vital. And then I also, nursing, I included the word nursing because I am a nurse, right? So, and then health, it's, it's explanatory. So, Evergreen Nursing Health. So, and then I had a vision. I wanted to create this little company to benefit, nurses and caregivers. Caregiving is such a hard job. So, of course, when you start out, you have to start out small, and it is a process you're going to go through, right? So, it took me about a year. I started the business in March 29, 2023, and now we have May 9th, 2024. So in February of this year, I finally got my my license from the Virginia Health Department to open my business. And that was just the first process. Now it's the second process is bringing up the business. So I started with home care despite being a nurse, because home care, you start small. So home care, now I'm going to come back to your question, what's the difference between home care and home health? And a lot of people don't even know what the difference is. The home care is non-skilled, it's long-term. Home health is skilled and it's usually short-term. Skilled nursing involves professionals, your nurse, your respiratory therapist, your physical therapist, your occupational therapist, your medical social worker, and sometimes speech therapist. So that's skilled nursing. And it is usually paid by Medicare 100%, so your insurance pays for that. Home care is non-skilled, and a lot of people don't know the difference. Non-skilled means he has caregivers. They are non-skilled. They take care of light housework, help you with, activity of daily living, getting you out of bed, getting you to the toilet in a safe way, So we have a lot of people with dementia and Alzheimer's, who need reorientation, and having a caregiver in your home makes this so much easier, and safer. So
now, when you say that they're non-skilled, and that, do they require degrees or any special training to be caregivers?
Well, as a caregiver, there is called a CNA, Certified Nursing Assistant, and it takes about 70 hours, to become certified, and it has to be certified by your state. So there is usually a registered nurse who's giving those trainings, and you're going to take a test, and then you become a certified nursing assistant. So, but you can also train caregivers, for their role in home. A lot of family members are caregivers, right? Yeah. So, and are they trained? They usually learn on the job, right?
Yes,
so,
that's true.
But to me, the most important is safety in their home. And in order to work safety, you have to have some skills and some knowledge. How to get somebody out of the bed, how to get somebody to the bathroom in a safe way, right? So, and a lot of family members take that kind of a role of a caregiver. So yeah, it is non-skilled. Now, skilled nursing, what do skilled nursing do? If you have a wound or a Foley catheter, they come in and change your catheter. They're going to do the wound care. And they're going to do education, teaching and education, right? That's skilled nursing. So, and then go back to home care, right? Home care and home health, two different things, two different shoes, walk together. Home health is skilled, home care is non-skilled.
Okay,
So yeah,
that really makes it makes it clear, because I think a lot of people, when they're faced with caring for loved ones or their parents, and they have to choose nurses or a nursing company, they're really not sure.
They're not sure. When people choose a home care agency, right, to have somebody in their home to do caregiving, they have no idea. Many times, who are you hiring, right? Are you hiring a person who bought a franchise, who has never done nursing, who doesn't do healthcare? Or do you want to hire a nurse who has a background in caring, right? That's all she does, right? For 30 years. So you have to be doing your research when you hire a home care company and make sure they really know what they're doing, and it's not all about profit, right? So it has to be, you know, you have to have compassion, you have to have heart, and you have to have skills and knowledge.
Well, what is your approach to helping clients realize that they may need caregivers?
So, you know, if, for example, if you have a mom or a dad at home and they're not able to take care of themselves anymore, right? So it's time to hire a caregiver. And I always, you know, I mean, you have different options. You can, you know, you can transition into a nursing home facility or an assisted living independence facility. But I think being at home is, if you live in a home for how many years, you raise your kids, most people don't want to leave their home.
Most people prefer to be in their home.
They want to stay at home. So, but you have to have a caregiver. It's not, the question is, are you safe at home? If the answer is no, then you need a caregiver. It's as simple as that.
And how do you find it easier if you get the children involved in the decision making?
Definitely.
Especially when you have parents who may feel that they don't really need the care, or they are very independent.
Right.
And that can...
You have to work with family. That's, you know, I mean, if your mom is not able to take care of herself anymore, you know, you want to hire a caregiver you want to trust, right? So if it's your mom, I talked with you, Michelle, right? So not with your mom who has dementia, and you want to make sure you're getting a caregiver who really understand what they're doing, right? So, and how they can take care of your mom in the best way, right? So hiring a home care business with what is led by a nurse is always your best option. Don't hire a plumber or an IT person or a CPA. Hire a nurse.
And how do you go about with the family making a plan of care for the patient?
So, you know, it's when we come in as we do a consultation first. So we sit down with the family. I want to know everything about your mom, everything about your dad, because that makes that, in this way, I can create a plan of care which fits that that person individually, right? So there is no one fits all. Everybody is different, right? So you want to sit down with family, and the family knows about their mom and dad, right? They will tell you their daily activities, what they like, what they dislike, right? So, and that's how you create your care plan, and then you put safety and you know, the medical history into place to really develop a good plan for them.
And are you working with their primary care physicians as well?
Yes, primary care physician, they're mostly important in skilled nursing because they're sending referrals, right? So, but you always should work with your primary care physician, right? Because, for example, if we're in a home and the patient has a fall, you inform the you know, primary care physician if there was an issue. If you pick up on respiratory issue, for example, right? They're getting short of breath and they have a heart failure. So you call the primary care doctor and you let them know. And at the same time, you also let the family know what your observations are. Even if it's a non-skilled setting. See, that's the benefit of having a nurse, you know, leading the home care business. Because you are able to pick up on issues, on health issues, on changes right away, you know. And you can also teach the caregiver. What if the caregiver has a question, a medical question? They call you up and say, listen, I'm observing something on Mr. Smith. Can you help me, right? So it's like triaging.
And you help the caregiver set up the home so that it can really accommodate the needs of the patient.
Do they need a hospital bed? You know, do they need accommodation? You know, can they go safely to the bathroom? Do they need a gate built, right? So how do you put somebody in a wheelchair? So that makes a difference, you know, when you hire a home care business, which is led by nursing, you know, by professionals. Simple.
So what are some of the biggest hurdles that you've come across when you've had to deal with difficult situations?
In what way?
In any, I don't know, I guess with families or
No.
patients who are hesitant.
Well, communication is the most important. Communicating with the family, communication, right? Communicating with the other members of the healthcare team is so important, right? Sometimes you have a problem, don't try to solve it by yourself. Reach out. First, you speak with family, and you just let them know your concerns, and then you reach out to the primary care physician, right? So, and then you reach out to the community. So, taking care of someone is not a one-person job. It is a village, right? So, and keeping them safe as well. So, and that's the most important. So, difficult situation require different solutions. You don't have one solution fits all. And you have to use common sense, right? How am I solve this problem? How can I help this person? How can I change that outcome to a positive one? I think you have to ask your questions, right? And sometimes you need to come, for example, if somebody is not safe to live by themselves, you have to, talk with family and say, maybe the solution is an assisted living facility, right? It all depends on the situation, on an individual.
Do you have any interesting stories that you like to share? Some
About
situations that you've had?
Well, I enjoy nursing. I could not do anything else than taking care of someone, and my heart is in the right place, and people feel that.
Yeah.
They feel if you're organic or if you're just there to make, a dollar. No. And they're picking up on this very easily, right? So, and if you show compassion, and if you go and so, you meet somebody, it just comes over naturally. Yeah. So you see a lot of things in patients' homes, but you cannot judge them. Everybody is unique. Everybody has a different story. And I'm a good listener. I love listening to their life stories, and I like to look at their family pictures. That really, I can relate. So, yeah.
That's wonderful.
I can give you an example. I was assigned to a patient, and he is playing the role of Santa Claus. Every Christmas in the mall, when you put the children on his lap, he is the Santa Claus. And when I visited him, he was in his Santa Claus outfit, and it was springtime.
So this is year round.
Yes. So he has Christmas all year round. And then he wanted to show me his entire outfit, Santa Claus outfit. Well, he couldn't find his shoes. And then, instead of putting the Santa Claus hat on, he put another hat on, right? But the outfit was there. So he sees himself as Santa Claus. It was so cute. Yeah.
That is sweet.
Yeah.
That is funny. That is funny. So, where do you see your company in the next 3 to 5 years?
So I have big plans for Evergreen Nursing Health. Eventually, right now we home care, but I hope in the next 2 years, I would say 2 years, we're gonna transition into home health because we're nurses, so we can do non-skilled and skilled. I also have a plan to educate, the next generation caregivers. So I would like to establish the Evergreen Teaching Institute, where we can train caregivers and med techs and even LPNs, right, to become the next generation of professional caregivers.
Do you think the country has enough right now?
No, there's such a shortage, and caregiver is. I really appreciate every caregiver because I did it myself. They work so hard and they don't get the appreciation they deserve, right? So I also think they should get paid a lot more.
Absolutely.
So for the work they do, yeah. And a lot of people who choose to be caregiver, they are very compassionate, That's what they want to do, taking care of somebody else.
And do you see more and more family members becoming caregivers?
Yes, it is
And
very.
they're going to need the training too.
Yeah, and it's very, very expensive
Yes.
to hire a home care, home care company.
And we just feel your passion, and you're so compassionate towards your patients. I know you visited with my mom for a little bit, and
Right.
it was so helpful. And we just wanted to say thank you, and it just meant a lot.
I know. Thank you so much. Yeah, I mean, everybody has a calling. My calling is taking care of others, right? So if you find out what your calling is, you're in the best place, right?
Absolutely. Absolutely. Well, I just want to say thank you again for coming by and sharing your story with us. And thank you for watching Nonprofit Spotlight with my special guest, founder and CEO of Evergreen Nursing Health, Deanna Nelsen. If you have any questions about today's segment, please see the information scrolling below. Have a wonderful week.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.